we're going to talk about the second mode of treatment, that is oral hypoglycemic agents or oral anti-diabetic medicines. The type of medications currently available for oral treatment for non-insulin dependent diabetes are sulfonylureas, which we'll come to in later class. Now it's been used more than 25 years. Now these are the kind of drugs. These kind of drugs are called as oral medications. These oral medications are used and indicated and contraindicated in a lot of ways. Let us check it out. What are the indications for oral drugs? Adult diabetes with no possibility of complications, just a regular old diabetes. Second, moderate rise and failed with diet method. You are a diabetic patient above the age of 40 years old. These are the main requirements. Now, when are they contraindicated? As I said, just the opposite. Ketosis prone diabetic patients with complications, pregnant patients or patients with renal insufficiency. These are the contraindications we have seen. Now, we're going to learn the different type of drugs and the duration of action. This is oral anti-diabetic drug. And what you see here is the classification. Now, if we see here, this drug, that is metformin, is being quite used and used. So, if you look at metformin, which comes from the group of biogonides, the duration of action is 12 hours and we use 500 mg in standard once daily. Other drugs which comes similar to this is fenformin. Duration is half, 8 to 12 hours, 25 to 50 mg and twice daily. Second group of drugs, that is known as sulfonylureas. You can see this is a sulfonylureas drugs, and when you enhance it, these drugs are comparatively used previously. Let's look at the first drug, glipizide, glycinide, these drugs have a duration of 12 to 8 hours, 5 mg and twice daily. These are drugs that are usually used in medications. These are other classification of drugs which you can learn and been used. Now let's turn about the insulin therapy. So insulin is more sure to normalize the blood glucose. Insulin therapy can be used subcutaneously. Only in emergency we give it as intramuscular or intravenous. So insulin, remember, it's given as subcutaneously. Only in emergency cases we give it as IM or IV. What can we see here is conventional insulin, short acting, intermediate acting, ultra short and long acting. Look at the timings here. Onset is half an hour to 1 hour. Peak is for 2 hours. Duration is for 6 hours. This is the short acting. Intermediate acting is 18 hours. Then ultra short, just look lag. To remember this, Lispro, Alsvet, glucosamine. That nearly takes 5 to 10 15 minutes. Look at the comparatively short time here. Half of 15 30 minutes. 55 10 5 to 10. It takes me 1 hour. Here it's 2 hours. And duration of is 2 hours. And long acting, this takes for nearly 1 day. When will you use this? Childhood diabetes, less than 15 years, diabetes who is considerably underweight, diabetes with tendency to develop ketosis. These are the main points. Now let's look at non-insulin dependent diabetes mellitus or diabetes type 2. In these kind of patients, this has been a chronic state, is advised through diet intake for nearly 4 to 8 weeks. Just pure diet intake and then check the glucose level. If it's less than 120, continue with this. It's more than 120, add fiber and exercise. And make sure we stress exercise in this. If that doesn't work, go for oral diabetic medications and keep increasing the dose. Thank you for today's class. We'll discuss more later.